So, Easterseals MORC serves communities in Michigan. We provide behavioral health and IDD services across the state. Easterseals MORC serves over 25,000 individuals per year. It's all on an outpatient basis. We serve all ages from infant to senior services. We do things like case management, therapy, supports coordination, peer supports, the whole spectrum of services for people who have behavioral health and IDD needs. And we have a lot of documentation requirements. We have a lot of payers. We work with commercial payers as well as PHPs and community mental health in Michigan. So we do have a lot of payers with a lot of different requirements, a lot of documentation and data. Actually, I like to tell people back when I was a case manager, when I started with Easterseals Michigan at the time, I was part of a work group that looked at documentation and how can we make it easier. And we just know that documentation requirements are not minimizing, they're not decreasing. Before it was, we do have an electronic health record. We tried to minimize duplicative entry as much as possible. But the reality is there's just quite a bit. And that's how we connected with Eleos because we thought maybe that's something that could help with our documentation. I think a few emails came through from Eleos. This was back in I think it was 2021, and what happened was I sent it off to our health informatics manager and said, "Hey, take a look at this. Let's see if it's something viable." And he actually messaged me personally while I was on vacation after attending a webinar and said, "Yeah, we need to pursue this." We saw this as a game changer for community mental health and for behavioral health in general. This was something that was not occurring in the state. We know, we've seen AI, right, in medical practices and that type of thing, but never in behavioral health. So we knew that this had the potential to really change the way that services were being provided and just how practice was happening in general. We heard the staff. A lot of people who were feeling frustrated or who were leaving the organization, especially if they were leaving for private practice, they were saying, well, documentation, there's a lot. And I just want to treat people. I just want to see people. That's what I went to school for. That's what kept me going. That was the whole, okay, they just want to serve. They just want to see the people and they just want to be able to provide, use their expertise to provide service and to kind of, make the community well. So that really was the commitment that we had was to the team members. Again, because this was so new, we decided to pilot. Part of it was, yes, adopting a new technology into our practice, but it was also kind of doing some stigma busting, which we're used to, right? We work in mental health. We understand stigma, but there's stigma around AI. And so we knew there was some education around that. We're not looking to take over jobs. AI is not here to do therapy. That isn't what we're here to do. We're here to serve people. I would say during the pilot, I think we had maybe like 20 to 30, 25 people maybe on the pilot. And once people started using it, honestly, it was their testimonials. It was their feedback, but it was the people that really were like, "Oh my gosh, this is working. This is this is doing what Elio said they would do," right? You never really know. A product may just be a product. It may be a sales pitch. Who knows, right? But when people were coming back and saying, "Yeah, I finished a progress note in 2 or 3 minutes," or "Hey, I'm gaining insights on my session that I wasn't gaining before because I couldn't see what was happening. Now I can go back and I can look and go, oh my gosh, maybe I missed something." It was capturing meaningful conversation. It was we've been using transcription software at the organization for a really long time, but this was different. This was that intelligent summary that Elios has been talking about. It just gave clinical insights into things that people, maybe they didn't have it back then. Obviously there's the reduction in time and documentation. We want to see that. But it was those insights. They're like, wait, it's making me a better clinician. And these are good clinicians already. But even more recently, I ran into somebody in the hall who has started using Elios just in like the past few months. They work with children. So they kind of work late. We see kids after school and that kind of thing. And they said, I usually stay on an hour or two. They're like, I go home within minutes now and I can just go home. They understand the importance of the data and the documentation and they want to do it well. But to put the time in it, there's a lot. You bring in AI and assistant to help you with that, you're going home within 15, 20 minutes of your last sweat session versus an hour to 2 hours. That's to me, that's significant. Take the time to educate people, including the people you serve, on AI, how we're using it, how we're not using it. We have no intention of using it to ever replace therapy
Mhm.
or that, that human contact. Be patient, have people be motivated to use it. And, there's a lot of positive sort of feedback you can say, this is what we're hoping it'll do to motivate people to use it. But be patient with people because it is a big change. I would say take the time to educate, answer questions, answer concerns, good or bad. That's one thing I love about Elios. You guys are like, hey, tell us the good and the bad. We want to hear it all. Don't just send us the savvy users. Send us everybody. We want to hear it all. And I've kind of modeled that. Like let's hear it all so that we can kind of work through everything. This is allowing clinicians and providers to return to what they had intended to do, which is provide service. Treat people, not the chart.